Hi, friends. Dr. Patel here with Hillside Medical Group. I hope you're having a wonderful day so far. Let's talk about preventive care today. Very important topic. A lot of confusion on what patients consider preventive care, what is considered preventive care for the physicians. So let's talk about that. What's a preventive care? It's an annual physical exam. Now, annual physical exams are covered by your insurance company on annual basis. Yes, only once a year. And yes, seems common sense, but we get patients coming in asking for annual physical every 3 months, which doesn't work that way. Annual physical is once a year. Okay, super important visit. Okay, this is where we will be talking to you about various things, such as yes, depression screening. Many patients get concerned that, oh man, they're asking me to write all this mental health questionnaire. They think I am not feeling well or depressed. Yes, it's a part of your annual physical. Okay, so we will be doing depression screening questionnaire, we'll be doing anxiety screening questionnaire, and then of course after the questionnaires are done, in my practice we do annual ekgs. It's always great to have a baseline ekg in case if we were to give you any medications that would require close monitoring, because some of the medications play with the rhythm of your heart. So it's great to have an annual baseline ekg that would be done at our practice, followed by the provider's visit. They'll talk to you about your blood pressure screening. So we'll get your vitals to see if your blood pressure is running normal. Provider will talk to you about your vaccine status. Now, I know, very debatable topic, not really in medical community, but some patients have very strong feelings about vaccines, which is fine. You're entitled to your opinions on it, but as a provider, as your doctor, we will discuss with you age appropriate vaccine schedule. In case if it's a flu season, listen, should you get a flu shot, COVID vaccine booster, tetanus shot, depending on your age, shingles vaccine, or pneumococcal vaccine. Followed by this, your provider will get a set of labs done on you for your annual physical, which would include checking your blood count, checking your kidney function, liver function, checking your vitamin D level, checking your thyroid, checking your sugar, cholesterol. So various labs that we would do, and conclude this visit. No part of this annual visit requires a physical exam. Of course, your provider will likely do a physical exam to listen to your heart, lungs, etc. But no part of this in your insurance world, in preventive care annual visit, requires a physical exam, but more so talking to you regarding your preventive measures. Of course, your provider will also speak with you regarding cancer screening based on age appropriate. In case if it's a female more than age 40, we will talk to you about your mammogram status. Anyone after the age of 45, we will talk to you about your colon cancer screening status. So those things will qualify for annual physical and wellness visit. All right, now let's talk about how is it different, because sometimes you get concerned that, well, do you also charge me copay on your wellness visit? Correct. If you have diagnosis that we're addressing, such as that screening for hypertension turned into treatment for hypertension, blood pressure, diabetes, cholesterol, anxiety, depression, or any other numerous, you're not feeling well today, sick visit. Now that does not fall under your wellness, right? Wellness is only screening aspect of it. So anything outside of screening would fall into an office visit where the copays and deductibles would apply. Very important for patients to get their annual visit completed, even if it leads to office visit, because knowing something is going on and getting ahead of it and getting treatment on it, so much more important than ignoring your diagnosis. But also financially, it's lucrative for you, because most of the times, a majority of the insurance companies or employers, your employer may have such a benefits plan built in, where if you do your annual wellness check and physicals, you will qualify for some sort of a discount. So even if say you ended up paying a small copay or deductible, chances are there is some sort of a tie-in with your insurance company built in that you just need to explore, which would easily pay for its cost, but even more. But also, annual physicals, wellness screening for these things, if we find your uh, medical challenges earlier on, if we diagnose you with these things earlier on, you can avoid damage that those diagnoses would cause over the years. Just because you're not screening for hypertension, but you have it and not getting treated for it, increases your risk of heart disease, kidney failure. Not screening for diabetes, but you have it and not being treated for it, increases your risk for, again, heart disease, stroke, infections in your feet, right? Diabetic neuropathy, numbness and burning sensation, and of course all the other complications, including kidney and liver failure from diabetes. So super important. Get your annual physicals completed. And if you don't have a primary care doctor, well, guess what? Hillside Primary Care is always interested in participating in your care, providing you and your family with the care. Dr. Patel will with Hillside Medical Group again.